Congenital megacolon, also known as Hirschsprung's disease or aganglionic megacolon, is a condition causing the inability or varying lengths of the colon, which is the large intestine, to relax. This results in colonic obstruction. Approximately 80% of patients present in the first few months of life, with the disease occurring in 1 in every 5,000 newborns. Most commonly, the disease is confined to the rectosigmoid colon, which accounts for 80 to 85% of cases. However, it can extend past this region in long segment disease, which accounts for about 20% of cases. Congenital megacolon is caused by the failed migration of colonic ganglion cells during weeks 4 to 12 of embryonic development. These cells are what allow the colon to contract, relax, and absorb. Extensive research has identified a number of key genes that regulate ganglionic migration, and genetic mutations in these genes likely contribute to the pathogenesis of congenital megacolon. Congenital megacolon can be both familial or develop spontaneously, and it is more common in boys than girls. Signs and symptoms of congenital megacolon range from colonic obstruction in the first 4 weeks of life to chronic constipation later in life. Some signs and symptoms in infants include failure to pass meconium in the first 24 hours of life, which is a substance lining newborns' intestines, poor feeding, vomiting, and infrequent, difficult, and/or explosive bowel movements. Symptoms and signs later in life include absence of soiling, chronic constipation, malnutrition, and the failure to thrive. All ages present with progressive abdominal distension. The treatment of congenital megacolon requires surgery in almost all cases. In otherwise healthy individuals with congenital megacolon, a pull-through surgery is conducted. This involves the removal of the rectum and the pulling through and removal of aganglionated colon. This leaves healthy, ganglionated colon, which is then connected to the anus. A colostomy, which is another surgical procedure, may also be performed prior to a pull-through if an individual has a significantly dilated colon due to colonic obstruction. In the management of congenital megacolon, both pre- and post-operative management should be considered. Pre-operative management can consist of methods to decompress the bowel, such as rectal irrigation or colostomy, as mentioned. Post-operative management should consist of pediatric or nursing care.